and a big problem for some, getting the second dose of the COVID vaccine.
New recommendations in Minnesota that will have your children getting a COVID test on a regular basis.
Plus, balloons and a pandemic. One woman opened shop at just the right time. Valley News Live at 10 starts right now.
This is Valley News Live at 10.
A Valley News Live exclusive tonight. A woman working in healthcare contacted our whistleblower hotline after being turned away from her original provider when she tried to get her second dose of the COVID-19 vaccine.
Valley News Team's Courtney Lockie investigated and explains why some people are falling through the cracks and what's being done to keep vaccines from going to waste.
Lost in the shuffle. That's how one Fargo healthcare worker felt as she spent her day scrambling to get her second dose of the COVID-19 vaccine. As a PRN for a local nursing home, she was given her first shot of the Pfizer vaccine. 21 days later, she came to work for her second dose, only to be turned away.
The facility said she was no longer employed with them, and because of this, she'd have to go elsewhere to get her second shot. While this may sound like an unusual case, it's something Sanford doctors tell me they're seeing a lot of.
If she wasn't able to get that second dose, it would be kind of a waste of a vaccine.
We've run into this type of example, somebody that was kind of working in a facility or a resident within a long-term care facility, received the first dose of vaccine. Either they're discharged from their change employment or not there anymore, but need that second dose.
In the case of our whistleblower, she was able to get her second dose at the new Gordman's Community Clinic after some serious legwork. But that hasn't been the case for everyone.
We're working on, if we get documentation, trying to accommodate those with our allocated second doses.
Dr. Griffin says it's essential they keep track of who has received the shot during a time when supply is critically low.
The supply is far, far lower than the demand, even amongst those patients at highest risk.
He adds they've made the local health department aware of the problem. We asked Fargo Cass Public Health what steps they're taking to make sure everyone completes the vaccine series. They told us they wouldn't grant an interview, choosing instead to send us an email saying they're working to develop a process to assist individuals in this situation, but will not discuss it until it's fully developed. In Fargo, Courtney Lockie, Valley News Live.
Now, if you find yourself in a similar situation, you should contact your local health department. Cass County's number is 701-241-1360. And if you need help uncovering fraud or corruption in your community, here's some advice. Call our whistleblower hotline. The phone number is on your screen, 701-237-6576. Call that number. Leave your tip. A member of our investigative team will get on the case and go to work to expose the truth.
The questions continue surrounding President Joe Biden's pledge to have 100 million people vaccinated in 100 days. According to Bloomberg, the country is already vaccinating 912,000 people a day. Health departments on both sides of the river say there's not a clear answer as to how many COVID-19 doses they can give out in 30 or 100 days. Clay County's public health says a little over 1,000 people have been vaccinated since January 5th, not including those in long-term care facilities. Fargo Cass Public Health says as of January 18th, the number of vaccinations is more than 4,200 over 13 clinics.
In Clay County, we have the capacity to do a lot more vaccine than what we're receiving. We're receiving just small amounts each week.
When we get the vaccine, our goal is to really get them administered as quickly as possible. And so what we have, our goal is really we receive them 1 week and we're administering in that same week.
Clay County Public Health has set up a hotline for more COVID-19 vaccination information. The number is 218-299-7204. Fargo Cass Public Health has more information on its website. Just download our VNL News app and get the link by clicking on this story.
The CDC says people should not get COVID-19 vaccines or flu vaccines at the same time. They say due to a lack of data on the COVID vaccine and other vaccines, they recommend a 14-day period before or after getting any other vaccines, including the flu.
Minnesota's health department has updated its recommendation for who should get tested for COVID-19. Reporter Jennifer Austin explains how it will affect your kids going to school.
The new recommendation encourages all children and college students returning to school and extracurricular activities to get tested, especially those ages 12 to 25, because that group is more likely to interact outside their household. But the health department wants everyone returning to school, even the youngest learners, to get tested.
Well, how often should kids be getting tested?
Really, that depends on the family and what works best for them. But I would recommend either every 2 weeks or maybe monthly.
Here's MDH Assistant Commissioner Dan Huff.
We have to look at what's practical. We have to look at what the risk is.
And that risk is different for every family. Live with grandpa and grandma? Maybe your kids should get tested more often.
The frequency of testing is more dependent upon what are the risks for you and your family. Are there, people with underlying conditions or grandparents interacting with the children?
So what if a child gets COVID-19 in between tests and brings it to school? That could happen, but Huff says testing will still help before things get out of control.
It enables us to detect outbreaks early so that we can prevent the transmission. It may not be your child that has it, but if a child in your kid's classroom has it, and that is detected through this screening, then we're able to protect everyone in that school.
It's not, we're going to catch every single kid the minute they get COVID-19. It's more this overall screening.
Yes.
Commissioner Huff did say parents should determine which type of COVID-19 test, saliva or nasal, works best for their child. He adds sometimes young children have a hard time getting enough saliva for that test to work.
An East Grand Forks restaurant owner says enough is enough with Minnesota's ever-changing COVID restrictions. He says he's now looking to move his business to North Dakota, saying he feels like Minnesota officials want to see business owners fail.
I'm done with Minnesota. I'm not dealing with it. It's almost like they are an abusive parent. I'm not doing anything wrong and they're still coming after me.
Bouchard says he's already received multiple leasing possibilities for the diner's new home. He tells Valley News Live once he secures a building on the North Dakota side, the transition will be immediate.
A bill working its way through the legislature would increase North Dakota's minimum wage. House Bill 1341 would bump it up to $9 an hour this year and continue to increase it by $1 an hour for the next several years. And it would keep going until hitting $15 an hour in 2027.
I don't believe that people can provide for themselves or their families on a $7.25 hourly wage, and I think this will increase people's livelihoods and help them to live in the state.
North Dakota's minimum wage was last increased to $7.25 an hour back in 2009.
Some lawmakers are looking to expand gun control rights in North Dakota. Sponsors of one bill say that they want North Dakota to join nearly 20 other states that don't require a permit to carry. That bill would remove all restrictions and limitations on carrying a handgun unless otherwise prohibited by law, including removing a recent law that allowed someone to carry a concealed handgun without a permit as long as the person was a state resident for a year.
It's closer to permitless carry, but even that is not necessarily true in the sense that you need to have a North Dakota driver's license with a residency of at least 1 year, and that in and of itself is sort of like a permit.
Hearing on another bill is scheduled Monday, which removes retreat requirements before using deadly force out of self-defense. Still ahead tonight on Valley News Live at 10, a woman opened a unique business during the pandemic. We'll show you how it's spreading joy to those during these difficult times.
But first, Nathan returns with the weather so you can plan your weekend.